Thank you very much. Okay, so what we are going to do now is we're going to be convening some feedback from the 3 workshops. We had the first one by Professor Michael Gallia, which was about, is mental health treated the same as physical health for persons living with a chronic condition? And feedback will be given by Gertrude, who was present in the workshop, and then Michael will fill up if necessary. We only have a couple of minutes per workshop, so Gertrude, could you come up here? And I'll give you my mic and you can share.
Basically, we agreed that physical and mental health are definitely related, and you need to learn how to manage your mental health, and in order to be in a better position to find the pain. There were points such the need to educate society, because people don't understand when people speak about mental health and physical health. Governments have limited resources. Sometimes it's okay, you're given medication and treatment for certain conditions, but not enough support is given for the mental health. An interesting aspect was a doctor who was in the group and raised the question that medical doctors are not trained enough to identify and treat the mental health problems related to physical conditions. An aspect is the importance of carers and the support that carers need. The financial burden which pain puts on families, especially, for example, when there is a limited number of therapy sessions for the person. And we obviously agreed on 2 important points: the need for research to have proof and validation of the mental health component, and that it is important and crucial when treating pain, chronic pain, and the need to, and also approaching this topic on a European level. And the last but not least, we need to look at the person as a whole, because you cannot separate the mental health and physical health.
Thank you, Gertrude. Anything else you want to add, Michael?
One concluding statement is this, that I feel very much about it. As healthcare professionals, you cannot be locked in a silo. You need to be also a social activist. I believe it very much. Okay? We are talking about chronic pain. We are talking about mental health, stigma. We cannot just keep meeting year after year from country to country and just share very often very similar material. We need also the social active component to push our politicians, yes, that listen, hey, hear us because there is this reality on the ground. And the best way we do that is through research, okay? Hard facts, okay? That's where things start get going. Thank you.
Thank you, Michael. Thank you, Michael. Shall I pass on to Bernard now? So we'll allow Mariella to have. It's okay. I don't know whether if it's on, but I think it is.
Hello.
Bernard is coming from an NGO in Malta, which is the Richmond's Foundation. It is the main NGO working with mental health. I have the pleasure of sitting on your board as well, so...
No pressure.
Okay, we'll give the floor to Bernard. No pressure, no.
We address the internalization of coping skills and resilience. And in this short workshops we had, we looked into how there are specific coping skills we can utilize that help us to bounce back from the day-to-day challenges we face. And we've looked at the different types of resilience, we've looked at the different types of coping skills, and we also delved a bit deeper into the understanding of how can we internalize these experiences? How can we internalize being better? How can we internalize the coping skills? And we said that internalization is all about doing something that allows it to become part of who you are, it becomes part of yourself. And that is what will help you bounce back from a situation or a challenge you are facing. And the key to unlocking this sense of resilience, to improve on the coping skills, it's all about awareness. And we kind of explored how awareness is the key to unlocking space for further growth and further development as well. So that was our workshop in a nutshell.
Thank you very much, Bernard. We now pass to Dr. Mariella Borgman-Tempo, who will give us some feedback on the self-management workshop.
Thank you. The workshop was to look at the experience Malta has had in delivering self-management programs to our population. And so we started with identifying what self-management is. It's a recognition that most of the care for the person occurs in their own time, in the home. We only spend a very short time with the health professionals, be them specialists, nurses, pharmacists, etc. So it's very much up to us to improve the way our condition is affecting our health. These are structured programs. They are based on scientific evidence. The first programs were set up in Stanford University around 1999 and resulted in a randomized controlled trial being delivered and published, which showed statistically significant improvements in behavior and various other parameters. So, of benefit both to the patient, the individual, but also to the health system, because there was also another study showed evidence of cost savings to the health system. So when we take into account the huge number of people with chronic diseases, this can be significant. The program we deliver in Malta are group sessions. After COVID, we also set up group sessions online. They're reaching a slightly different audience, for example, in the workplace. And our other sessions are held in person with small groups between 10 to 15. The aim is to build skills in the participants. They are led by both a health professional and an expert patient. These programs are not specific to arthritis and the rheumatic diseases, but the skills are general and they are suitable and helpful for any person living with a chronic condition. One of the key things is to help people understand what a SMART goal is and to agree their own SMART goal and to practice it in the week between each session. And then we go through different skills, such as different types of relaxation, mindfulness, positive self-talk. So, you know, it's already, a lot of it has been mentioned here as well. But as well, things like healthy nutrition, physical activity, bearing in mind both these are areas where the evidence is changing continuously. There's also a lot of misinformation. So where, you know, we talk to our participants about where actually to look for reliable information and how to critically use some critical thinking but when they look for information. Also things like preparing for the health visit, how to deal with their medication, relaxation, breathing techniques, and so on. Living with a chronic condition, basically. So at the end, unfortunately, we didn't have much time, but there was a short discussion about how NGOs can actually set up these programs and whether they're relevant to them. and the difference between the structured program and self-help group, because there is a difference. How maybe apps might be used in the future and how useful apps can be. And also, I think a general understanding that it's become a bit more difficult to recruit participants after COVID, maybe because of our very hectic lifestyle, but it seemed to be a common thread. Thank you very much.
Morning with us and giving us such an interesting session. Thank you to all the participants, because this was really you were very actively involved, and we had a very good... There was someone who had a question. Okay.
We were talking, you hear me? We were talking about self-management in our group, and I was asking, how can we prevent people from become hypochondriac instead of self-management? Like they're not too picky in the disease instead of getting well.
Very often they will need psychological help, okay? Because there is a very powerful book. It's called Games People Play, and on transaction analysis. But basically, what it says is that very often we play games with each other. So that you accept me and applaud me, I'll try to be nice to you, okay? Wearing a mask. The worst part is when I wear a mask to myself. And with hypochondriasis, very often people are living a lie with themselves. Deep down they know there is something not on, okay? Or they are making up for it, or creating, or lying, okay, about the condition. So it has to do with the individual's personal level of maturity. But if that is quite shallow, then the person needs help. The problem with this kind of population is that they do not accept that they have an issue, a problem. So the same with borderline personality disorder. Nowadays it's called emotional dysregulation. People do not accept that they have an issue, a problem. And so what can you do? And you are quite limited with that. But if the person is willing to work on his or her own issues, then yes, there is help around.
Have another question?
Thank you. It was very important, these 3 topics that we had this morning. Thank you very much for your time. I would like to inform everybody that AGORA was, some years ago, had the project about self-management, and we trained our member organizations on self-management, and like in Malta and in Cyprus, the patient organization for RMDs running the self-management program, and it's very successful. In Cyprus, we continuously run it for 10 years, and we have all the times we have a lot of participants, and we have also a waiting list for this. So people and patients are willing to learn how to manage their condition and how to manage their life. We have to give them the space to learn it. Thank you.
Thank you, Andre. I think it is now time for the stretching exercises. But before we leave these sessions, I want to thank Andre for highlighting that about self-management. Thank Michael for highlighting Viktor Frankl's quote about I can, so we can. And also Bernard for the community resilience, where people come together to support each other, which is exactly what we are doing. We are here to support each other. Thank you.
We have exercise weight. It's not finished yet. Exercises?
No, just
Movement.
it's an hour exercise.
We have exercise. Yes, we have exercise.
Okay. For this session, exercise, I think it's better to continue what we start this morning. So we are going to dance, alternative way of exercise, okay?
Stalo, if
Thank you, thank you.